Spread of unexplained death in Kano State and the need for enforcement of COVID-19 initiatives across the Federation. Let me use this opportunity to thank the leadership and members of this Honorable House and indeed the entire National Assembly for your immense support and determination to help the country fight this pandemic. Mr. Speaker, honorable members, the COVID-19 was declared a global pandemic on 30th January 2020. As at that date, there were 7,818 cases globally. Out of this number, China had 7,736, while the rest of the world had 82 cases, spreading over 18 countries. As at 4th of May 2020, the global figure had risen to 3,640,473 cases worldwide, 1,192,909 recovered, and 251,817 fatalities across 212 countries. Coming home, Nigeria's index case was recorded on 27th February 2020. As at the 4th of May 2020, Nigeria had recorded 2,802 cases, 417 recovered, and 93 fatalities. Tomorrow, 6th May 2020, will mark 100 days since the novel coronavirus COVID-19 was first detected in our country.
You don't understand.
I have given you these numbers to underscore the deadliness of the pandemic and to show the aptness of its description as the most important public health challenge of our generation. As I have often said, the virus has come to disrupt and destroy our health and our wealth. The impact of the outbreak is summed up vividly by the disruption to the global economy and to the healthcare systems that were hitherto regarded as standard and stable. More advanced and sophisticated systems have struggled in the face of the onslaught of COVID-19. Nations around the world have had to deal with this outbreak for shorter or longer days. We are, however, determined by a resolve to ensure we protect our citizens and ourselves from this virus, being fully aware of our circumstances. Mr. Speaker, honorable members, before I address the situation in Kano specifically, there is a need to lay a foundation of how far we have come in the fight to control the spread of COVID-19 since the inauguration of the Presidential Task Force. In the period under review, we have accomplished the following. Under policy focus, we have developed a multi-sectoral response action plan to guide our national response through high-level engagement with the organized private sector for better coordination of their core competencies and expertise, mobilization of states and local government area resources in preparation for the possible spread of the disease into communities, state needs assessment and state of preparedness, stimulating economic national interest to mitigate negative effects of the pandemic, encouraging our indigenous researchers to develop appropriate solutions for our environment. Arrangements are underway to evacuate Nigerians from different parts of the world. Mandatory 14-day quarantine for returnees from other parts of the world. Support for strengthening subnational level response. engagement of local manufacturers across the board for the stimulation of local production of essential commodities to reduce dependence of imported commodities, local production of face masks, hand sanitizers, protective gear, etc. Clinical review of state of health systems in focal states and the Federal Capital Territory. Identification of available capacities for isolation and treatment of COVID-19 patients, which has yielded over 3,787 beds across facilities, and improved surveillance systems. Under the National Response Strategy, this strategy involves detection, testing, contact tracing, and treatment. And two, the efficiency of the identification, testing, evacuation, and isolation process increased significantly. Under testing and manpower expansion, we have increased the number of laboratories since we started from 5 to 21, with a final objective of establishing 1 lab per state. We have increased testing capacity with over 80% conducted in Lagos, Kano, and the FCT. The laboratories in Lagos and the FCT were expanded to have the capacity to test a minimum of 1,500 samples daily. We've increased bed space to a total of 3,787 as at 4th May 2020. We have followed up a total of 11,840 persons, representing 95% of the contacts out of 12,504 earmarked for contact tracing. About 9,828 health workers have been trained. 2,725 of them are doctors, 1,942 are nurses, and 5,161 are other health workers. That is to increase the human resource available for case management. We have also secured insurance cover for 5,000 frontline health workers through the insurance industry. Government and health professionals had to sign an MOU on hazard allowance and other incentives. Under infrastructure development, Mr. Speaker, honorable members, state public health emergency operation centers have been activated across the nation. More personal protective equipment and ventilators have also been procured. Completion of more isolation centers with a total capacity for over 3,500 nationwide. We have advised each of the state governors to provide isolation centers with at least 300 bed spaces in their various states. Under mobilization and management of resources, we have additional resources mobilized through an international community, the private sector, and public-spirited individuals. Donations have been received into a designated CBN account by the Accountant General of the Federation. Private sector donors are to deliver specific infrastructure projects to strengthen the system nationwide. And lastly, government funding has been released and utilization is at advanced stages of completion. Under relief materials and distribution, government has released 70,000 metric tons of grains for distribution as relief. It has also released through the Nigerian Customs Services 158 trucks of rice and other condiments for distribution to the states. Payment of the conditional cash transfers is being made. List of beneficiaries of the conditional cash transfer is being expanded by 1 million as directed by Mr. President. Mr. President has also authorized the employment of 774,000 Nigerians across the 774 local governments of the Federation. He has also authorized continuation of the school feeding program to sustain the nutritional value for our children. He has also commended and instructed that distribution of palliative be enhanced through an ongoing process in collaboration with the state governments. The focus is on the poor, aged, sick, and vulnerable. Under the heading of consultation with stakeholders, we have consulted significantly on all processes with the state governors. We have consulted with the leadership of the National Assembly. We have consulted with traditional and religious leaders, labor sector, security agencies, under the non-pharmaceutical measures. In order to contain the spread of the pandemic, the Presidential Task Force recommended the introduction of non-pharmaceutical interventions, which include 1, restriction of travel to and from 15 high-burden countries worldwide, closure of land, sea, and airports of entry, lockdown of Lagos, Ogun, and Kano State, as well as the Federal Capital Territory, launch the stay-at-home campaign, introduce the policy of physical distancing, observance of personal hygiene, like washing of hands.